Hi class, my name is Marina and I will be discussing breast cancer precautions you can take at home today. 1 in 8 women will have something in common this year. Can you take a guess what it is? Well, it's life-changing and can turn your world upside down. 1 in 8 women will be diagnosed with breast cancer this year. That's a pretty high number. Just think of it as every one person out of every 8 people you know may be diagnosed with cancer. In 2019, an estimated 252,000 women will be diagnosed with breast cancer. Breast cancer is one of the leading causes of death for women. This year alone, it's estimated that 47,000 women will die from breast cancer. Despite the high numbers of the diagnosis and death, there are also 3.5 million cancer survivors in the United States. There are certain precautions, signs, and symptoms that all women should know about, and that is what I will be talking to you today about. Breast cancer is a cancer that forms in the cells of the breast. When breast cancer is detected early and is in a localized stage, the 5-year relative survival rate is 100%. So early detection, including doing self-monthly breast exams and scheduling regular clinical breast exams visits and mammograms are key. To start doing these exams at home, you can start in the shower. Use the pads of your fingers to move around your entire breast area in a circular pattern, moving from the outside to the center, checking the entire breast and armpit area. Check both breasts each month, feeling for any lumps, thickening, or hardening knots. Notice any changes or you feel a lump, definitely get evaluated by your healthcare provider. When you're in front of the mirror, visually inspect your breasts with your arms at your side. Raise your arms high over your head. Look for any changes in the contouring, any swelling, any dimpling of the skin, changes in the nipples. Rest your palms on your hips and press firmly to flex your chest muscles. Left and right breasts will not be exactly a match. Few women's breasts do. So look for any dimpling, puckering, or changes, particularly on one side. When you're lying down, the breast tissue spreads out evenly along the chest wall. Place a pillow under your right shoulder and your right arm behind your head. Using your left hand, move the pads of your fingers around the right breast, gently in small circular motions, covering the entire breast area and armpit. Things to look out for. So I printed this diagram. So feeling a thick area, a dimpling, any crust coming from your nipple, red or hot, any fluid leakage, any skin sores. If you have any bumps, you'll definitely want to get that check it out. Any growing veins that you have not noticed before, any sunken nipples, new shapes or sizes, and the texture of just your breast skin, if you notice that it has been changing, and any hard lumps. So if you do see any of these, set up an appointment with your doctor. They can check your breasts for you. They will look for all of the symptoms that I just mentioned, and they will make a note in your chart. If they suspect anything, they will send you out for a mammogram. A mammogram is an x-ray that allows a qualified specialist to examine the breast tissue for any suspicious areas. The breast is exposed to a small dose of ionizing radiation that produces an image of the breast tissue. Mammograms can often show a breast lump before it can be felt. They can also show tiny clusters of calcium called microcalcifications. Lumps or specks can be caused by cancers, fatty cells, cysts. If further tests are needed to find out if any abnormal cells are present. It is recommended that women 40 and over have a mammogram every other year. It is recommended that women who are younger than 40 and have a history of breast cancer within their families should speak to their physician in terms of how often they should have a mammogram. Of course, there are other things that you can do to prevent breast cancer, such as maintaining a healthy weight, staying physically fit, limited alcohol, consumption, as well as not smoking. The goal of screening exams for breast cancer detection is to identify breast abnormalities as soon as possible. If breast cancer is found, there are more treatment options and a better chance for survival. Thank you.